The question often gets asked, what is a hiatal hernia and how do you treat it? So I think one thing is important to separate the concept of hiatal hernia from that of the lower esophageal sphincter and its treatment and augmentation. A hiatal hernia is defined when the lower esophageal sphincter, where your esophagus meets your stomach, rises up into the chest and takes part of the stomach with it. So it is designed to sit 2 to 4 centimeters below the diaphragm in the abdominal cavity, but when it goes up into the chest, then that's considered a hiatal hernia. The hernia itself is an opening in the diaphragm, and it's allowing part of the stomach to move through it. There are 4 types of hiatal hernias. One is a sliding hiatal hernia, and this is simply where everything is in line. You have your esophagus, you have your lower esophageal sphincter, and the stomach is coming up right underneath it. Second is a type 2 paraesophageal hernia, and this is where the lower esophageal sphincter is mostly in place and part of the stomach has herniated around the sphincter and moved up into the chest. A type 3 is known as a mixed type paraesophageal hernia, and that is where the stomach is above the lower esophageal sphincter and it too has risen into the chest. And we have some illustrations here to help you visualize that. And finally is a type 4 hiatal hernia, where not only is the stomach and lower esophageal sphincter in the chest, but other abdominal contents, pancreas, spleen, colon, small bowel, something else is up there as well. All of these are amenable to surgical correction. However, it's important to note that just because someone is diagnosed with a hiatal hernia does not mean that they need surgery necessarily. So we have to put all the information together. Certainly a hiatal hernia will predispose someone to having symptoms of reflux, because when you move the sphincter into the chest is a negative pressure zone and it allows for more active reflux, even in a competent sphincter. So it's not that you absolutely have to have surgery. Lots of people have hiatal hernias, but hernias can be very troublesome, and in some cases they can even be life-threatening. So we need to evaluate the entire patient and put that hernia into context. So hiatal hernias are a huge topic. I'll try and condense it down into just a few short minutes, but there are 4 types of hiatal hernias. The most common is a type 1 or sliding hiatal hernia. This is where the junction between your esophagus and your stomach, which is known as the lower esophageal sphincter, is able to go through the diaphragm right here, and your stomach pooches into the chest. This allows for more and more frequent reflux, because the sphincter that is designed to be in a positive pressure environment is now in a negative pressure environment, and it kind of allows that to become a superhighway for reflux. And so this is how it allows for these more severe and increased symptoms of GERD. Does everyone need to be fixed? The answer is no. These can be very small to actually quite large. And so we really look at the patient, the symptoms, and the size of the hernia to try to determine whether these need to be fixed. Often we see these at the time of surgery, and if we are doing surgery, we will almost always fix them at the time of surgery. The next 3 types of hiatal hernias I'll talk about all really need to have a surgical element associated with them. The very least, they need to be evaluated by a surgeon and potentially be fixed. So a type 2 paraesophageal hernia is where the sphincter and the esophagus remains in the stomach. So a type 2 paraesophageal hernia is where the lower esophageal sphincter and stomach remain in the abdomen, but part of the stomach, the top part, has managed to get around and through the hole in the diaphragm and is now stuck in the chest. And this can cause chest pain, difficulty swallowing. The stomach can die, and this can turn into a true surgical emergency. So if you have one of these, you really need to talk to an experienced surgeon and think about getting it fixed. The type 3 paraesophageal hernia is what's known as a mixed type hernia. This is where the sphincter as well as the stomach are up into the chest, and it has the appearance of a type 2 paraesophageal hernia, but it is well in the chest, and often these cause significant symptoms and is probably the most common type of hernia that I fix. Finally, we have a type 4 hiatal hernia, and this is where you have any element of the previous three, plus you have other organs up into the chest, and this would include things like the spleen, the colon, small bowel, pancreas, all sorts of things. I've pulled all sorts of organs out of the chest that shouldn't normally be there. So that is a little bit about hiatal hernias and paraesophageal hernias. Certainly, again, not everyone needs to be fixed, but we know that they can contribute to the symptoms as well as the complications from GERD.